Footprint medialization is an important and more recently developed concept. We can see in this large rotator cuff tendon tear in this right shoulder in the beach chair position that lateralization only to the most medial aspect of the anatomic footprint is possible. By medializing the footprint, which involves simply excising the articular cartilage from the most lateral portion of the humeral head as shown, will allow for exposure of more medial chondral and subchondral bone that can theoretically help increase the chances of rotator cuff healing. In large tears such as this, external rotation of the humeral head, as shown, can expose more of the humeral head and allow complete excision of, in this case, approximately 1 centimeter of superior humeral head articular cartilage. Now when we pull the cuff over, it reduces to the same location, but now there's more medial exposed chondral and subchondral bone available. The remainder of the anatomic footprint of the greater tuberosity are debrided to encourage healing, and crimson duvet type marrow stimulation can also be carried out at this more lateral portion of the greater tuberosity. Anchors are placed here along this new area, and note that there's some marrow elements that exude through these vented anchors. We can see that in this particular example, we're using 3 triple-loaded vented anchors. They're placed at the most medial aspect of the anatomic footprint, but again, there's more medial bone exposed now. The authors also think it's very important to diligently incorporate the superior capsule, as shown here, into rotator cuff repairs, and this 50-yard line view using the camera helps facilitate that incorporation. Sutures are then sequentially passed, and we can see here that a single row ripstop orientation construct is used to repair this rotator cuff tendon tear. After suture tying, we can see a complete repair, again at a significantly medialized footprint with exposure of the more lateral footprint as shown, but a secure repair. In this second example, again a right shoulder in the beach chair position, we can see a much smaller tear, but when we try to lateralize the cuff, it's obvious that the cuff repair, if reapproximated to the most lateral aspect of the footprint, would create significant tension in the repair. The authors feel that in this particular example, even though it's a smaller tear, that it should be reapproximated to a significantly more medial position. And in order to do that, the authors feel that removal of some of the superior humeral head articular cartilage with medialization of the footprint in this even smaller tear is advisable and preferred. Again, a burr type shaver can be brought in and articular cartilage simply removed to expose more medial bone. The anchor is then placed in a medial position, and again note the marrow elements that exude from deeper elements of the humeral head with these vented anchors. A repair has been carried out in this more medialized position as shown.